In the year 2000, the U.S. Surgeon General called dental caries the silent epidemic. Millions of preschool children in this country face traumatic oral surgery for a disease that, with proper care, education, and most importantly, access to dental care, is entirely preventable. Early childhood caries is the most common chronic disease of childhood, 5 times more common than asthma, and 7 times more common than hay fever. But now, thanks to a collaboration between state, local, and nonprofit agencies, access to quality baby and childhood dentistry is as easy as ABCD.
The problem that dramatically hit everybody's eye was the problem of decay in baby teeth in children 3 years and under. And in those days it was called baby bottle tooth decay. These days people are calling it early childhood caries, and it's a bit of an epidemic nationally, and unfortunately hits low-income children harder than it does other children.
About 10 years ago, Drs. Milgram and Demoto at the University of Washington recognized this problem of so many kids at age 3 or 4 having 10, 15 out of 20 primary teeth affected by dental caries, holes in their teeth. They were required to be treated under general anesthesia, and there was an unlimited supply of children like that. They said, we've got to find a better way. We have the science and the technology to prevent the disease. We just need to get the kids in earlier. So they developed a program which partnered various entities, the objective of which was to train dentists, train dental offices, to bring the children in at a young age, by age 1, and prevent this disease from occurring in the first place.
The goal of the ABCD program is to decrease dental disease by increasing access to dental care for children up to 6 years old who are Medicaid eligible. The program emphasizes early intervention, prevention, education, and comprehensive care.
But you want to do it twice a day?
The Washington Dental Service Foundation is just one of the actors in the overall scheme of things. In addition to local dentists, local public health, University of Washington, and the state Medicaid program, the foundation steps in and provides funding to local communities to pay for the startup expenses associated with the ABCD program.
What Medical Assistance Administration has to offer to the program is that we offer an enhanced fee to dentists who care for the young children and provide services and provide a dental home for them.
One of the core functions of the health department is to ensure folks have access to critical health services, and oral health is one of those services. So this was an opportunity for the health department to be involved with children who needed access to health care but weren't getting it.
The dentists participating in ABCD are trained and certified in early childhood oral health, with an emphasis on the prevention and diagnosis of early childhood caries.
Remember how he tipped the chair back?
Early childhood caries involves a child's primary teeth. The disease occurs when bacteria break down carbohydrates, producing acid that attacks teeth. Caries can be identified in 4 stages: white spot lesions, mild caries, moderate caries, and severe caries.
We can have an infant who comes in at a 1-year check, has 6 or 8 teeth, and they look really good, come back 6 months later and their teeth are all crumbling and brown, and some of them even broken off at the gum line already. It's absolutely stunning to see how bad things can become in a short period of time.
The bacteria that cause caries can be transmitted during close contact between parents or caregivers and children. This usually occurs when the child is between 12 and 30 months of age. For this reason, it is important for dental providers to be aware of the primary caregiver's oral health history to properly assess the caries risk factors for the child. If the parent has a history of dental caries, the child will be at greater risk. Once the bacteria have been introduced, There are multiple factors that can either help or hinder the caries process. Good feeding habits, proper oral hygiene, and sufficient fluoride can all prevent caries. Frequent snacking, sweet snacks, and drinks promote the disease. Children with plaque-covered teeth are at high risk. Fluoride helps fight caries as it inhibits bacterial metabolism and demineralization. But not all communities have fluoridated water. For some children, a fluoride supplement, including topical fluoride toothpaste, gel, or varnish, may be recommended.
You have to realize that this problem of oral health, oral disease, is a generational one. And so many of those children come from families where they've never had regular preventive care. They've been locked in a vicious cycle of emergent care, pain, suffering, and relief of pain, and then back into being detached from the care system, and then developing pain, going back for emergent care. So by offering possibility of prevention, which will relieve them and break the cycle, is a great hope to many families.
If I have an immigrant family that has 6 kids, maybe the first one goes to the OR. Maybe even the second one goes to the OR. The third one does not go to the OR. The fourth one does not go to the OR. By the time we get down to the third and fourth one, we actually have people who understand that brushing is a necessity. Flossing is important. Seeing the dentist on a regular basis is important.
Children from low socioeconomic status experience the majority of tooth decay. Nearly twice as many children from disadvantaged economic backgrounds experience decay. Low birth weight is also correlated with enamel defects, putting those children at risk. And children with special health care needs, or those on medications, can also be at risk. That's why it is so important for primary care providers, such as pediatricians, to recognize the importance of oral health.
Pediatricians historically have seen children at a very young age many times. So they're seeing this problem. They're the ones who are seeing and reporting this problem, and their concern has been, we want our colleagues in dentistry to work with us to manage this in their dental home. The ABCD program, for us, fits perfectly into a comprehensive program we have here at the University of Washington called ECHO, spelled ECOH, stands for Early Childhood Oral Health. We're educating dentists and their offices in the community. We are providing service to patients who are desperately in need, and we're engaging in very important research.
So what we're going to do today...
When treating infants and toddlers, it's helpful to tell them what you're about to do, show them, and then do the procedure. It helps to involve the parent or caregiver and to play and establish a rapport with the child. Make the child feel safe in your office. The knee-to-knee exam provides good positioning and can be used by parents at home who are having difficulty brushing a child's teeth. The parent and examiner sit knee-to-knee, with the child on the parent's lap, legs around the waist of the parent. Then he or she is tilted back on the examiner's knees. The parent holds the child's hands while the examiner stabilizes the child's head with one hand and lifts the lip with the other. The examiner then prompts the child to open his or her mouth. The surface of the 4 front teeth are examined first, and then, using the mirror, the back surface of the front teeth. The rest of the mouth is then examined using a mirror when appropriate.
Spread along the outsides of the teeth all the way around.
A lift the lip exam is a great opportunity to demonstrate proper brushing techniques to parents. A child may cry during the exam. It helps to reassure the parents that the procedure does not hurt.
What I tell parents now who are always trying to go, shh, 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 it's okay, shh, shh. As I said, let them cry. When they cry, their mouth is open. I'll work, I'll be done. Once you sit them back up, they quit. I mean, I don't have anybody who goes out of my office still crying. As soon as we sit them up, they go, okay, prize box. Don't I get a toy?
He also has lots of crowding in his mouth.
Dental professionals should also provide parents with counseling on prevention of dental disease.
The role of ABCD is primarily to educate the parents about how important their role is. They're the ones that are home every day that have to implement the recommendations that we give.
Mom, let me just show Mom something too while she's here.
Oral development, including tooth development, primary teeth, teething, and eruption patterns, are all topics the participating dentists discuss with parents. The importance of fluoride is another critical topic. The application of a fluoride varnish can help prevent decay. Habits like finger sucking and pacifiers, diet and bottle feeding practices, and injury prevention are all important topics for patient counseling.
Even on the big wheel, because kids tend to fall, they can hit their mouth or hit their head, and we definitely...
Enrollment in the ABCD program is growing, and so is the number of participating dentists.
All right, can you open it real wide like an alligator?
More children are having their first dental exam at an earlier age. The ABCD program is working.
Thank you. Thanks for coming.
The evidence is in, and it is overwhelming. In Washington State, we have 39 counties. 23 of those counties have ABCD programs now. And in ABCD counties, the utilization of dental services by children under the age of 6 has increased from 22 to 34%.
I think this program for dentists, in terms of the concept and the commitment, is key to the survival of our profession, because it's really the high road. It's about dealing with families who are at greatest need and delivering services that are both needed and effective.
I would encourage the general dentist to join the ABCD program because, one, we're treating a population that needs to be treated. We can't ignore that population. And two, they'll get a lot of personal satisfaction out of seeing their efforts being appreciated by the population that they're treating. Third, they're going to have these children in their practice over the lifetime, and it's very, very gratifying to watch children grow from a small child to an adult, and that's a friendship that you'll have forever.
The ABCD program is striving to mitigate the many problems caused by the most common chronic disease of childhood. Working together, providers and local and state agencies are confronting the problem head-on.
Can you give me 5? All right.
Access to quality baby and childhood dentistry is something to smile about.